I'm Andrea Leonard. I am the president and founder of the Cancer Exercise Training Institute, and I am here with
Shannon Burrows.
And she is a 2-year breast cancer survivor and a cancer exercise specialist extraordinaire. And I wanted Shannon to share a little bit about her personal journey since it is Breast Cancer Awareness Month. What compelled you, what of your personal struggles compelled you to become a cancer exercise specialist and help others?
July 13th, 2017, that's what compelled me to do it. I got diagnosed with breast cancer. I was a personal trainer, fitness instructor, group training, and at that point I didn't know how I was going to be able to continue on with my career and my journey, and so thankfully I found you and I was able to complete the course while I was going through my recovery and everything. And then
Sorry, I can't help but stare at her pink nails while she's doing this. This is awesome.
it's pink. Look at my breast cancer.
Okay, sorry, back on track here.
Yes, so I wanted to figure out how I was going to be able to get through my own journey, my exercises, and how I was going to be able to train and help others that are either going to be diagnosed or preventing it or going through treatment. So
out of everything that you struggled with, what would you say was the most misleading thing or the thing you were the least informed about after you had come out of your surgery? You know, you want to get back into working out, and can you think of any one thing that you would tell breast cancer survivors out there or personal trainers who are working with survivors that they must absolutely know about when it comes to exercising?
They absolutely need to know about lymphedema because most doctors don't talk about it, and most patients don't realize that they are at risk for that.
Do you want to tell people what it is, or do you want me to?
You can, and,
Oh,
the other thing I was going to say is chest exercises, because when you leave the doctor's office, most doctors don't talk to you at all about exercises because they're just not aware.
Yeah.
And being that that's my profession, you know, I wanted to be able to know what I could and could not do and what my limitations were for myself and others.
Okay, so absolutely, when you have expanders placed, absolutely no chest exercises. So not only does that mean no pushing, that also means pulling, because
Correct.
you're going to stretch your chest muscles.
Even in a plank position.
Absolutely.
It feels weird.
So I just talked to a breast cancer survivor or patient the other day, and her doctor, unbeknownst to him, instructed her to do a plank, which automatically puts your pecs in a contracted position.
Right.
So that's one thing. And then after you get your expanders removed, 6 weeks is what I usually tell people, just to be on the safe side, before they start doing any type of exercises. Slow, gradual progression. So even though you may have been doing 15-pound chest presses before, you have to start at the beginning, so 0, 1, 2, 3, starting with light weights, few reps, because of lymphedema. So lymphedema is the swelling of the extremity,
Extremities.
and it can also be in your pec or your lat area if you had radiation. And it is preventable, entirely
Yep.
preventable, with education, and we can elaborate more on that in another video. But you can also identify it at early stages by simply pressing your thumb.
And you get that white mark.
Yeah, throughout your arm, because it will hold the indentation, unlike where it blanches and refills. It's kind of like silly putty. So we have specific lymph drainage exercises and elevation of the arm after exercise and going through this sequence that will help to minimize the risk and minimize swelling if people do have it.
Another thing was range of motion. I didn't realize how much I was going to lack in range of motion. I'm thankful that I was already into fitness prior to being diagnosed, so my recovery was a little bit easier, but you know, still have my own limitations of, you know, what's happening. I constantly stretch every single day, you know, my chest muscles and whatnot, but yeah.
Well, and if somebody does not have what we are going to consider full range of motion prior to lifting weights, it can actually limit your ability to get that range of motion
Right.
back, because you become stronger in that kind of reduced plane of motion.
Right.
So for more information about the Cancer Exercise Specialist, and there is also a Cancer Exercise Specialist directory with you in West Palm Beach, I believe you're listed in, go to thecancerspecialist.com. So www.thecancerspecialist.com.